Lipedema is a diagnosis and a disease that we're still learning a lot about. It's a little bit more coming to the forefront, I think, of our minds in our department and as therapists, that if a woman's presenting with a history of several decades of big legs, disproportionate to their upper body, and attempts to try to lose weight, really frustrated that they've dieted and they've exercised and they've been very rigorous trying weight management techniques and strategies, and they've had no success, that there has to be an underlying reason. The lymphedema isn't enough of a diagnosis. It doesn't explain why the legs have gotten to the point that they are now. It's the lipedema that has really compromised their lymphatics in the end, or by the time we see them. And it's the lipedema that's going to continue to progress because it's a disease. And that is really revealing when many of these women have never heard about lipedema before. It suddenly explains why they weren't able to lose weight, why exercise didn't make a big difference, why their legs are painful and they bruise easily. And all these things were never explained before. And to have a mystery like that for decades, I think has to be, it's really sad. It's really sad to hear. These women finally understand the fat is a disease. It's not a question of lifestyle. It's not a question of, poorly managing their health. And that there's hope in learning, I think, how to prevent it from getting worse, but also just more information on what it is that they have. So then the important piece is to look at, now that I understand I have this fat disease, what are the things that will work and how can you prevent it from getting worse? Lymphatic fluid is fluid that's comprised of proteins, fat cells, waste products from the metabolism in our bodies with organs function and muscle function. It's comprised of larger molecules that won't fit into the venules. Our circulatory system filters 90% of the fluid in our body. The lymphatic system only actually filters the other 10% of the fluid, but that fluid is protein rich and it has very larger cells. So it's when the lymphatic system's compromised, that fluid that's in the interstitial space is protein rich and causes a lot more fibrosis and thickening and hardening of the connective tissues. Fibrosis is connective tissue that gets hard, and it's the cumulative effect of adding more and more proteins to that area. So it's getting hard and also getting thicker and thicker because there are more proteins lying down on that connective tissue. And it's amazing the results you can get with fibrotic tissue if you really work it manually. With our massages, we work with circular techniques and stronger deep tissue techniques to help break it up. It's a mechanical breakdown of that tissue. Movement, the heat from the hands helps to break it up. But we also use, with the bandaging, we use foam, and we can use different thicknesses, densities of foams. We can use planes along a large area, or we cut them up into little chips that we put in bags and that lie under the bandages and just create this little bit of a mechanical massage all day long while patients are walking, moving, and that motion helps to break up fibrotic tissue. But it's through massage or the motion of the foam, you can get the fibrosis to loosen and soften. And you really have to do that before you can get the lymphatics to flow again. The thing that's so important, though, to kind of get the patients to buy into and really talk about is once you've softened that fibrosis and really reduced a lot of the inflammation or the swelling, patients need to stay in compression all the time, because as soon as those proteins, are allowed to kind of move back into that interstitial space, the lymphatic system, we know, is always going to be compromised. This isn't a problem that's going to be fixed and go away. It's something they're going to have to kind of prevent from progressing. And I think the patients that really do understand, they buy into it, they really can maintain that reduction for years and years. But the fibrosis is something that we see a lot, and it can't just reduce with garments. You have to have manual treatment. You have to have massage and manual lymphatic drainage, which is a very gentle, therapeutic massage that really targets the lymphatic system, working from the larger vessels where the lymphatic system connects up with the venous system, and the largest vessel in the body that cuts through the diaphragm, and is really stimulated by deep breathing. So we start with education on deep breathing right away, and manual lymphatic techniques that help move fluid into the lymphatic vessels. This fluid that's just stuck in the interstitial space, that's very protein rich, can't be absorbed into the veins. So it's lingering in this interstitial space, and the lymphatic system, because it's impaired, isn't able to draw that fluid into the lymphatic capillaries. And so with the manual stretching techniques, it's very different. It often surprises patients because they're expecting to come in for a deep tissue massage, which it isn't. That doesn't target the superficial lymphatics. It's more of a stretching of the skin in the direction we want the fluid to move. And that stretching opens up the lymphatic capillaries to help draw fluid from that interstitial space. And if they've had some trauma to the lymphatics, if they've had lymph nodes excised or they have scars from previous surgeries, then we work around those scars because those can block lymphatic flow. So we try to move fluid to areas where it can flow and into larger vessels. We teach patients how to do the sequence themselves as well, or if there's a family member or a partner, a caregiver who can also do it for them. This is something that will help them manage long term. But the patients find it to be, I think, very soothing and relaxing as well. And for patients who have lipedema, where there's so much tenderness and pain and achiness, I think it's especially effective in just helping to reduce their pain. And they'll, express that at the end of the session, and that it lasts for a while. Women can stay much healthier if they don't feel so frustrated about trying to do exercise or, watching what they eat and not getting any results. I think when women know what it is and look at how it can progress, there is a lot of motivation there to say, how can I keep it from getting worse? How can I get it, keep it from going to the next stage? Until they know that they had lipedema and that hormonal disturbances can cause these progression of the disease, then they can appreciate why it happened. But a lot of women just can't. There's no explanation for why they went from having very thin legs, wearing short skirts or short shorts, to suddenly wanting to wear long skirts or wanting to hide their legs, progressing to not going outside as often, or not being able to explain it to family, or getting ridiculed by family. Like, what, all of a sudden you've gained all this weight? Why? I think that's finally knowing that's the diagnosis is really liberating.